Hi friends, you probably have some hearing loss if you use power tools, gardening tools, loud kitchen tools, listen to loud music, especially with your earbuds, and work in a loud environment without ear protection. How about your kids? Do you know how loud they're listening on their devices? Obviously, loud noises are what you should avoid to preserve your hearing. So please dial down this video if it's too loud. And preserving your hearing preserves your brain health, and you will improve the quality of your life, reduce your dementia risk, and reduce the frustration of your family by 100%. I was really touched watching this video on how Mr. Beast helped 1,000 deaf people get hearing aids. Now, he did this in 7 countries spanning 4 continents. I find it incredible how someone with absolutely no medical background, who has ever worked a day in his life in the healthcare industry, could not only give the gift of hearing to those 1,000 people, but he single-handedly reduced their risk of dementia by at least 30%. Now, if you compare a neurotoxin like alcohol, even if you quit it, it only reduces dementia by 12%, which is a big deal if you are at risk for dementia. Mr. Beast helping one person restore hearing, he has indirectly helped everyone else that individual knows. Hats off to you, Mr. Beast. If you're watching this, I would love to chat with you on other ideas that could dramatically improve the lives of thousands of people. Now, you may be wondering how these people lost their hearing. Unfortunately, for many, it's really hard to pinpoint. Now, don't think that hearing loss only affects old people. It's kind of like hair. Some people begin to lose their hair in their 20s, and some people have a full head of hair in their 90s. But just about everyone is losing hair. It is important to correct the problem of hearing loss as soon as possible. And this is why you should take your child to the pediatrician every year, especially if they're getting multiple ear infections. Now, most people will ignore their hearing loss, but sudden hearing loss within 72 hours is actually a medical emergency because potentially it's reversible if you get to a doctor on time. Now, some people wake up deaf on one side or notice their hearing disappearing, like releasing the air from a tire, or hearing a sudden click or pop and have no hearing. Sometimes you may have balance and gait issues. Sometimes you may have problems walking. The problem is that there is a short window of time in which we can intervene. Now, definitely, if you have ear pain or drainage or sudden dizziness or imbalance without any of those symptoms, you should go to the emergency room ASAP. You may wonder what we can do to improve your hearing. Well, that depends on the root cause and whether it's reversible. If it's earwax, getting that removed may do the trick. And keep in mind, if you're on a medication, certain medications may cause hearing loss, such as chemotherapy for cancer or autoimmune disease, treatments like hydroxychloroquine, which gained a lot of popularity in the last few years. Now, if there ever is a better alternative, I would always try to avoid that. And as an infectious disease doctor, we try to avoid giving aminoglycoside antibiotics, which can cause damage to the 8th nerve. But because of drug resistance, sometimes we have no choice but to use those kind of toxic medications. Now, if the hearing loss is from an infection, then treating the infection or supporting your body through the symptoms with, let's say, nasal decongestants or nasal steroids or even antihistamines, sometimes it can improve the symptoms. Now, keep in mind, antibiotics don't treat viruses, and the more antibiotics you take, for any reason, the more you change your own healthy microbiome, which together can change your immune system. And usually it's not for the better. Now, viruses often can affect your ear structure, but occasionally it can actually directly attack your 8th nerve, which is responsible for your ability to hear. Now, you may have heard that Justin Bieber had Ramsey Hunt syndrome, which is caused by a virus such as herpes zoster virus that attacks the 7th and 8th cranial nerve to paralyze the face and cause hearing loss. Really severe cases can attack the brain as well. Now, this is obviously a medical emergency because we can aggressively treat you with an IV antiviral called acyclovir. Now, chances are you may have discovered that you have a bit of hearing difficulty in the last few years because all of a sudden, we're masked up and you could no longer read lips. Now, it would be unwise to think that now that we're unmasked, that your problem is resolved, because you never know where you're going to go in which masks are going to be required. Like the healthcare system, which you will need in an emergency. And we need to talk to you. I can't tell you how many times patients tell me they can't hear me and want me to take off my mask. That is not going to happen. So we usually end up speaking very loudly or writing the entire conversation. And don't forget, if you can't hear the sermon at church, you're just going to fall asleep and make your pastor feel bad. So please go get tested and fitted for proper hearing aids. It's really worth your quality of life. Whatever the reason for your hearing loss, your body needs support with proper nutrition with a diet rich in B vitamins such as vitamin B1, B6, niacin, and B12, and also omega-3 fats because that's what your nervous system needs to repair. Reducing inflammation with adequate sleep, exercise, and avoidance of toxins such as heavy metals or other infections are in general super important to do. So if you want to learn more about B vitamins and immune supplements, check out this next video.